Hi, I'm Dr. Jason Posner, and you're watching the Plastic Surgery Channel.
There are a lot of different options with liposuction right now, and it's gotten really confusing to try to sort through all of this stuff. It used to be that there was liposuction, now there's brand name liposuction and a whole variety of flavors. The basics are that I think everybody's going to infuse a solution to numb the area and it expands the fat layer. You'll hear terms like tumescent technique, wet technique. I think that's fairly standard. The new things are things like using ultrasound. That's actually been around for about 10 years now, but it's gone through improvements in technology. And the most common one you hear about now is called Vaser. Then there's lasers, and that's an idea that's also been around for a while, but it's really kind of come into its own in the last couple of years. And there are different lasers. They all have the same idea of pre-treating the fat before you suction it out to sort of emulsify it, kind of break it up a little bit. And they also are trying to put heat into the connective tissue around the fat to try to get some tissue shrinkage. And so trying to figure out how best to do that, how to really control it, is where we are right now with that. Then there's the version called water-assisted, where they're just basically pulsing a jet of water in. That is touted as kind of a gentler way of doing it. People feel that if you're harvesting that fat to maybe re-inject it somewhere else, that might be a nice way to do it. That's something that's still kind of new, and so I think it remains to be seen how useful that really is. And just, plain old liposuction is still a pretty viable way to go for most people. You don't really need to go for a brand name with it. I think you really just need to shop around and make sure you're going to somebody who does a lot of liposuction. I would suggest go to a board-certified plastic surgeon, because they're going to be in a good position to know whether liposuction or even something else entirely is the way to go. But don't just be sold on a brand name. Really try to understand what it is that you're trying to accomplish with it. Personally, I think you should always be able to meet with the surgeon who's going to be doing the procedure. We're seeing a lot of clinics now where the model is you're meeting with basically a salesperson who's making the clinical decision about whether or not you're a good liposuction candidate. And of course, you're always a good candidate for it if you're the person in front of them.